the International Patient Safety and Healthcare Worker Safety Awareness Week. A very, very important topic, especially, of course, now with the pandemic. This is something that we really want to put a big focus on globally. So on that note, I want to, first of all, let the two speakers we have today introduce themselves. So first of all, Alan Donnelly, welcome. And can you tell us a little bit more about you and your work?
Well, thanks very much, Christina. And can I thank you and AHIMA for hosting this during this very important week. I chair the G20 Health and Development Partnership, which was created at the beginning of 2017 to get health on the agenda of the G20, which it had never been in the past. And so we're now working with many partners from around the world to make sure that health system resilience and health system strengthening is addressed not only by health ministers, but by finance ministers, heads of government, and central bank governors.
Thank you, Alan. And also, I just wanted to add, of course, that AHIMA is a recent member of the G20 Health and Development Partnership. So we're very
welcome. We're delighted you've joined us. Thank you.
Very honored to be part of that. And that's a good segue to our other speaker, Tim McDonald. And his company is also a member of the G20 Health and Development Partnership. So we're in great company here. Tim, tell us a bit more about you and your company.
Well, thanks very much. And I'm so pleased to be here. My name is Tim McDonald. I am a physician and an attorney, and I have worked at the interface of medicine and law for about 20 years, and my key focus has been on patient safety. I've joined RLDatix, which is the international leader in patient safety software and software solutions. And it's really exciting to be with you as we look towards the future of really pursuing zero preventable patient harm and health worker safety.
Excellent. Thank you so much, Tim. And I recently was introduced to your colleagues and was just really impressed by the sort of global mission that you're working on in patient safety. So looking forward to having many more conversations with you and your colleagues on this important topic. So I wanted to mention that today we're also together because the G20 Health and Development Partnership and RLDatix are hosting an event this week with some very impressive people that have been involved, including Dr. Tedros. And hoping you could tell us a little more about the upcoming event. And I know this is about a report that you're going to be publishing that you've been working on for quite some time. And so hoping you could kind of shed a little bit of light on that. And maybe, Alan, I'll start with you. Could you tell us a bit more?
Thanks, Christina. Yeah, the approach that we've been taking is to get as wide a number of people and organizations interested in the whole issue of health, because we see that if you have healthy citizens, you have a healthy economy. And so health should not only be something that's discussed by clinicians and scientists and so forth, it's of interest to us all. And if you look, of course, with the pandemic, which devastated global economies last year, you can see what happens when things go wrong. And of course, one of the hidden pandemics that has not been addressed is the issue of patient and healthcare safety. And as I'm sure Tim will outline a little bit later, it's extraordinary the number of people who suffer harm when they go to hospital for a hospital visit around the world, not just in low and middle income countries, by the way, but right across the board. And then the other thing that we found, particularly last year and this year, although it has always been a problem in the healthcare sector, is the impact that this has on the occupational health and safety of the frontline healthcare workers. And we're seeing many frontline healthcare workers putting their lives at risk at the moment to tackle COVID-19 and treat people. Their mental health is damaged. They're taking potentially a deadly disease back to their families. And so it's really important that when we talk about patient safety, we look at healthcare worker safety too. And of course, this week is Patient Safety Awareness Week with the World Health Organization. And so I'm really grateful that RLDatix agreed to sponsor this report, which gathers together some views, op-eds, if you like, from a wide range of people, not only people involved in health. So, for example, the head of the International Labour Organization has written a chapter on the impact for workers who are working in healthcare. Dr. Tedros, of course, the head of the WHO, has done so. But we've got lots of other people who don't come from a health background who are explaining why we have to have a new approach to this and why we need to have some standards in place, why we need to be able to measure what's happening with patients and also learn by the mistakes and make sure that we can improve the system. The number of people around the world and the economic cost of incidents where patients are hurt or damaged is enormous, and it's happening every year. And that's why we're saying it's a hidden pandemic.
Yeah. No, and I of course completely agree with you about the importance of the topic. I've been introduced recently to some of these quite frightening numbers. What I heard was about 5 million people a year, or patients, are dying because of adverse events and so on. And being Danish myself, in Denmark, we're 5 million people, so that would be the equivalent of wiping out Denmark once a year. So it's really some astounding numbers. On that note, Tim, wanted to turn over to you. So for this week, we're using the hashtag #ZeroHarm, also just to not to make it broad both for patients and healthcare workers. And I wanted to see, so in your opinion, what would you say are some of the global barriers for achieving that goal, both for patients and healthcare workers?
Well, and certainly a laudable goal, right? Pursuing zero preventable harm based on the number you just mentioned. And that only includes the patients who die from preventable harm, but not all the other people who suffer serious injuries, due to preventable harm. So the impact, both in human terms as well as financial terms, is staggering, which is why the pursuit of this goal is so important from a human perspective, as well as the financial perspective. And one of the biggest barriers that we encounter, that the goal that we're focusing on this week, is the need for transparency, data, empathy, and compassion. What we're calling for is sort of an empathic high reliability. And we learned that also from the aviation industry. When they became more transparent and began to look at their data, they did achieve high reliability. And that is why aviation is so safe now. So we are on a journey in many ways to model after aviation, this approach to transparency, but also infusing into it empathy and compassion, which COVID-19 is now demonstrated for patients, families, the loved ones, and the health workers. It's never been more important.
Yeah. No, I really like that. I was talking to a doctor the other day working in a hospital, and they were talking about the challenges of sort of radiating empathy, or like when you're covered with a mask up to here with sometimes like a plastic seal over your face, and the patient in the same situation, and how sometimes a virtual visit can be much more beneficial and empathetic. Because you're not, you can actually see another person's facial expression. So I think definitely also empathy. That's something that's we need to highlight more in the meeting between doctor and patient moving forwards.
Sure. Thank you for that. I can say we've actually studied the ability to provide empathy and compassion training through virtual training. We're able to take the mask off and be able to do it, Christina. And we have shown a remarkable ability to do that
Yeah.
And so I love the fact that you have brought that up and pointed it out. It's a great use of technology and software in terms of being able to do that. So thank you for that.
Oh, that's very interesting. Yeah, look forward to hearing more about that. So, and another thing you mentioned was about the data. And of course, at AHIMA, we believe, the health information management, that part is really a key part of the healthcare transformation. And I was just wondering, what's your viewpoint in seeing the connection there between the health information and the patients and healthcare worker safety?
So there's a concept called applied safety intelligence, which is looking at all these different data points and trying to pull them together in a way through often predictive analytics. We can prevent the harm in the first place before it ever occurs. Now, we need to respond empathically, when it does occur, but the key is preventing it in the first place. And to be able to do that, we need really, really excellent software that integrates what we have in the electronic health records that's pulled into software that can analyze trends and other predictive ideas out there that the software is picking up to begin to look at. And again, it is a model that has worked in other industries. And I think we are on the cusp of being able to do that. And that's why I love the fact that we are on a global mission, because the hope in many ways also is how do we make sure that even the low and middle income countries have access to these kind of analytics, so we will be able to help them as well and help them rise and help them also prevent these harm events that hurt both the patients as well as the healthcare workers.
Yeah. No, I love that point about comparing ourselves to other industries, because I think there's been a bit of digital in health has just been slow to accelerate compared to other industries. And I think that's a very nice thing with the G20 Health and Development Partnership, is that they have some members that are not sort of your classic healthcare type members, but really can come with some insights from some other industries. And you mentioned aviation. Yeah, go ahead.
Christina, just let me say there that we've got a team of experts from a wide range, as you've said, of industries and organizations, not purely health organizations, who are looking, as was described yesterday to me, as health in the digital age. So it's not digital health as such, it's health in the digital age. And this is where I think, we really have to ensure that health in the digital age is rapidly transformational. One of the things I like about RLDatix, by the way, and why we were pleased to have them as a partner, is they don't monetize the data of the people who are stored on their platforms. The data, I think when we're talking about using big data here, we're looking at trends, and we're looking at how do you gather that data in a way that it can be valuable to the key decision makers. But I think we would all agree that we don't believe that monetizing the data of patients, it's something that must be protected. But the interesting thing is the World Health Organization now, and I believe the G20 and the G7 this year, will be looking very much at health in the digital age. And they'll recognize that big, not just steps, leaps forward have to be made now if we're going to improve pandemic preparedness and response, and if we're going to improve health system resilience. And I know back in 2019, when the Japanese had the presidency of the G20, the Japanese Prime Minister at that time was very keen that in Japan, where you have an aging population and the population is falling, the use of digital tools is going to be absolutely essential, because they're simply not going to have the people to do the things the way in which they've done them in the past. So it's about using technology, but using it safely and using it ethically, I think, which is so important.
Yeah. No, I couldn't agree more. And I can see Tim's also nodding his head, and I think we all definitely agree. one of the things I think COVID has demonstrated, and Tim, I wanted to ask you as well about that. RLDatix, you work across the globe on patient safety projects and so on. I think the pandemic has really highlighted that, talking about data, we haven't been able to exchange data because we're lacking sort of global standards. And I wanted to see if you see an opportunity there to create some sort of global standards for patient safety, if you think that that could be something that could maybe solve some of the issues that we have around this.
Oh, I think, Christina, it's a great opportunity, and it's also why I'm so excited about the G20. So let's think about aviation again, right? The way that aviation then took the transparency and took the data to make improvement was creating international standards related to aviation, so that when we're in Australia and we're speaking to people in Japan or in Canada, we're speaking the same language and in many ways with the same taxonomy. And that's what's so exciting about what's going to come up, within the G20. And when you think about digitalizing this, you now have this excellent opportunity to use that again to try to get, again, the same taxonomies. So when we think about in aviation, when there's a crash, it doesn't matter where the crash is in the world. The GO team related to that looks at those events in the same way with the same standards, but also they also have the empathic component where you are communicating empathically to the passengers and their families, but also the workers, the people on that plane get incredible emotional first aid whenever there's a sort of mishap. So I do see this great opportunity to create global standards, and let's learn from these other industries how we can go about doing that and do it well. And that's why Alan's leadership, really pushing forward a lot of this work in the G20, makes me so proud to be part of RLDatix that's going in to help and do that.
What's really interesting, Christina, from what Tim has just said, we had the economic crisis in 2008 and 2009, the banking crisis with the collapse of the subprime market. And what happened, and as you know, the financial services sector is incredibly complex, where you've got derivatives and you've got very exotic products being traded. The financial services sector and the regulators, and it was under the leadership of President Obama and Gordon Brown, who was then the British Prime Minister. And what they did was they got the regulators together, and within a very short period of time, they had put in place very rigorous common standards to measure the resilience of the banking system. And they put in place common standards to ensure that we couldn't have a systemic collapse again. And I think what Tim is talking about, if we can do it in the financial services sector, which was a very complex sector and it moved very rapidly, then there's absolutely no reason at all why we can't do this when it comes to patient safety and healthcare worker safety. And as Tim mentioned, in low and middle income countries, often in clinics and so forth, you may only have part-time staff, people who have other jobs but help out in a local clinic in a town or a village. And also, of course, you have people who may not have had the training they require. And so when we're talking about patient safety and healthcare worker safety, using digital technology, we want to make sure we've got a toolbox of training that can be offered to people, regardless of where they live in the world, so they can have the tools to ensure that people can have safe care if they are if they're in a clinic or they're in a hospital.
No, so I think, so this is a plea, I think, to the partnership, let's do as good old Elvis said, there's been too much talk and less action. I think standards should really be something we can come together and, can really be one of the keys for solving some of the challenges in patient safety, but also across a number of other issues that have happened in the pandemic. So Appreciate that. I love as well the aviation correlation there, because I think a pilot and a physician have a lot in common. They sort of have a lot of lives in their hands that they're responsible for once that plane takes off. I think if a pilot was equipped by the level of real-time data that a physician in many hospitals today have available to them, they would be in pretty bad shape, and we would be seeing way more plane crashes. And so I think this is an industry we can actually learn a lot from when it comes to healthcare, and we should have that same standard. A physician should be as equipped as a pilot. But anyhow, we can talk. Sorry, go ahead.
Christine, if I could. So I'm so glad you brought that up, because COVID-19 has created even a greater parallel, and Alan mentioned it. So we do know in aviation, the pilot is really incentivized not to crash for their own personal safety.
Yeah.
Well, for the first time ever, really, with this pandemic, physicians and nurses and others are themselves in peril.
Yeah.
As they go in and they take care. And that is why that connection you just mentioned is so true now more than ever, is that every time we go into a room to do something, we're in peril. In fact, the data shows for anesthesiologists, which I am, if I intubate somebody who has COVID-19, I have a huge possibility that I myself may develop COVID-19, prior to us getting the vaccination. So that parallel you just drew is so very important now.
Thank you for that.
Christina, I'm going to have to leave the webinar now, but I'd like to thank you so much. And I'm so pleased that AHIMA is a member, and we look forward to doing many more really interesting things with you. And we look forward to the launch of the report this week. So thank you for your support.
Thank you so much, Alan, and thank you for your very valuable time and comments here today. So
Thank
you.
Thank you. Thank you, Alan. It's an honor to be recorded with you.
So Tim, we have a few minutes left. So let's talk a little bit more about something. And I want to go back to, we are in this global situation where health challenges, I think what COVID's really demonstrated is that we all share the same challenges in healthcare, more or less. And I think that's why partnerships like the G20 are so important now, more than ever, because we need to look around the world and see where do we find best practices that we can all learn from. And those might not come from the obvious places. And so with your global experience, tell us a little more, are there any specific regions or cities or countries that should sort of be called out and that others should look towards a little bit more to learn from good practices and examples?
Well, Christina, thank you for that. Often we talk about learning from mistakes and defects, but we can also learn from excellence. And there are some amazing things happening in countries, regions, health systems, and even individual hospitals that we're learning a lot from. So when you think of just in the UK, in Wales, they have done some amazing work around the use of one of the software, platforms we call DCIQ. They've really been able to use that to leverage the approach to these events to learn as much as possible. And then I have spent a wonderful amount of time in Australia and working with the Clinical Excellence Commission down there. Very focused on this learning from events and really improving it and preventing harm. And the other thing that they've been doing down in Australia is also teaching their learners, their students, whether it's nursing students or the medical students, all the way up to the trainees, the importance of patient safety, but also transparency. I also worked with them on their legislation around being transparent when harm occurs. And then, coming to a place I'm, of course, very familiar with in North America, you have some very large systems that are very committed to this pursuit of zero preventable harm. One example would be the University of California. They really use the software to drive a lot of improvements, and they've seen a lot of serious reductions in safety events. And again, one of the other organizations I'm very, very proud of is Christiana Care. Heather Farley there runs their program on health worker safety and providing peer support when harm events happen. And she was part of developing the Candor Toolkit, which is focused on this. And they are an incredible organization. In fact, the New York Times did a feature on how well they have been responding, these days, as it relates to, again, health worker safety. So there's a huge list of these excellent, things that are happening out there. And what I'm hoping for with the G20 is a better way to share these stories, these lessons learned. And that's why I'm so glad you all are part of this, because I'm sure you're learning the power and the importance also of embedding these learnings into the EMR, so that there would be ways that we can trigger different ways to approach these events when they happen. So lots of excellent things that are happening around the world. I could go on and on and on for the next hour about some of the great places where things are really happening.
Great. Well, I think with RLDatix, I mean, you're in a great position to be calling out some of these great examples from around the world that we really need to, put some attention to. And sort of leading from there, now we have a couple of minutes left. And going back to this thinking about, less talk, more action, what would you say maybe be like one action that many people in the world could maybe take on as of today, think about and potentially implement that would have a real big effect when it comes to reducing harm?
Well, my firm belief, it goes back to how we began, speaking today. And that is that health worker safety is, in my view, the most critical thing we can all focus on right now. Because unless the health worker feels physically and psychologically safe, they cannot deliver safe and empathic patient care. Mm-hmm. So I really believe now more than ever in COVID-19, we need to focus on that. Yeah. And recently, I was very pleased to be able to publish an article in the New England Journal of Medicine giving some very practical tips that all organizations can do, again, to focus on this providing emotional first aid in a principled and systematic way in all organizations. And so there are tools around how do you go about doing that. And that's where the EMR comes into place, as well as software, because we can identify through the EMR when there may be needs to reach out to provide emotional first aid, and the software can drive that in a highly reliable way. And again, that's one of the things I'm most excited about with the G20 is a way we can digitalize hardwiring these best practices any place in the world to be able to do that. But we need to have the leadership focused on this issue, Christina, if we're going to get there. It has to become a very high priority. And if it does, I think it's really going to help us on this journey to pursue zero preventable harm.
Yeah. Thank you so much, Tim. I mean, I couldn't agree more. And I think, Alan is not with us anymore, but certainly the opportunity that we have now is two organizations being part of the global or the G20 Health and Development Partnerships puts us in a unique position now to carry some of that responsibility of bringing these important topics out to the global leaders of the world. So I can't say in words how much I've enjoyed meeting you and talking about this important conversation, and looking forward to joining the event this week and also reading your reports that you're going to be publishing on this very important topic. So thank you so much for joining us here today. I know it's very early where you are, so really appreciate it. Thank you so much.
Thank you, Christina. It really has been an honor to speak to you. And I want to thank you for all you are doing to really pursue this sort of goal of zero preventable harm. I've learned throughout the years that media can play a huge role to raise the high priority around this. So I really thank you from the bottom of my heart for really engaging us in this conversation. Thank you so much.
You're so welcome. It's a great pleasure. Have a good day. Bye.
Bye-bye.